When I was 7 years old, I was eating a bowl of ramen, and I didn't expect what came next. Suddenly, my throat started to tighten and it was getting harder to breathe. But luckily, my friend's mom had a Porsche, so I was able to get to the hospital quickly. And that's where a life-saving dose of an EpiPen was administered. Today, the EpiPen is an essential medical device carried by everyone that has severe allergic reactions. And yet, the cost for it is increasing year over year. What's causing this? When we think about life-saving medicine, we expect it to be available, affordable, and constantly innovating. And yet, the opposite is happening. Costs soar, prices increase, and as a result of that, it's getting difficult for us to afford it. In 2007, one EpiPen costed $100, and by 2016, it rose to $500. That is a 400% increase in under a decade. The product didn't change, the medication stayed the same, and because they expire annually, people had to buy it often, year over year, even if they didn't use it. This got me questioning, what was causing this? Was it the lack of innovation? Was it because of inflation? Or is it something else? I believe that is a cause of strategic, legal, and business practices that limit competition. According to Harvard Health, the main factor in increasing the cost of EpiPens is a lack of competition. And today, I want to offer a new perspective into how our health is being affected by anti-competitive practices that shrink competition and increase the price of our products. According to Harvard Health, the main factor in increasing the price of EpiPens is the lack of competition. And just like the De Beers case of the diamond monopoly, a single manufacturer like the EpiPen reduces the supply of the product, and therefore prices could be increased. And at the end of the day, the consumers pay the price. Why should anyone spend 2 months' salary on a life-saving product? This isn't like diamonds or anything. And when done right, antitrust laws, which are generally referred to as laws that restrict competition, anti-competitive practices, it can help reduce prices, drive innovation, and make companies more efficient through competition. Because of this, manufacturers are forced to work harder, but a better and cheaper product is made. And at the end of the day, everyone benefits and everyone is happy. I mean, the whole idea of capitalism is based on this competition. And although we are here in Singapore, I want to highlight how in the United States, antitrust enforcement was able to protect consumer access to medical devices. One of the best examples is the Federal Trade Commission, the FTC's case against inhaler companies. In 2023, the FTC sent warnings to inhaler companies and forced them to delist patents that restricted the entry of new drug companies. These patents limited the number of companies that could come in and make new products, and therefore, there were little competition and there were few alternatives for us consumers. And according to Lina Khan, who was a former chair of the FTC, the manufacturers delisted the patents, and so the cost of an inhaler went from hundreds of dollars to just $35. So therefore, it seems here that antitrust laws was able to protect people's access to inhalers. But it wasn't just in the inhaler markets. According to the FTC, the delisting also set the stage for the removal of junk listings on a range of other medical devices. So effectively, antitrust enforcement against one area of the medical industry was able to regulate another. And it's not just an inhaler market. For legal reasons, I won't be able to get into details of the other cases, but we've seen insurance companies, other drug companies, and other businesses in the medical field get fined, warned, and forced to delist these patents and to drive competition again. I believe that antitrust victories don't get as much coverage as I think they should. And more importantly, I want to stress that a lot of the times, regulation is not enough. In most cases, we see companies slapped with a small fine or just a warning, and it's just a cost of doing business for them. Effectively, reforms aren't being made. And today's theme of health calls on us to rethink health and what it really means. Clearly, health is more than just the absence of illness. It is also the foundation for stability in our lives. From the inhaler market to other cases, we can see how intervention and enforcement can increase competition, lower prices, and improve our access to care. We, as individuals, should be aware of how we can advocate for competition in order to protect consumer choice and live a healthier society. Antitrust laws aren't perfect, but when they work, they can make healthcare fair. So I leave you all with this. We should put our trust in antitrust. Thank you.